We normalize the idea of periods being horrible and terrible.
That your body's symptoms are intelligent, they are information and communication, and it is our job to learn how to decode them. If you're like, oh no, like I have a little bit of spotting, a little bit of, speckles of blood, or just like really light bleeding for a day or two, and then I start bleeding. I can't tell you how many people tell me that. Like it's the most normal thing, but that's a huge sign that you are not making enough progesterone. Trying to conceive, but you're having really painful periods. Like this is a huge clue. Your body is telling you something's wrong. Welcome back to Healthy as a Mother. I'm your co-host, Dr. Leah Gordon, and this is the show for becoming and being a mother, where Dr. Morgan and I share the natural women's health and motherhood guidance you've been looking for through a fresh, functional, and balanced lens. Today, I'm going to dive through all of the different cycle clues that you could be paying attention to that will tell you about your hormones and your fertility. Everything from spotting before your period to pain during ovulation or short cycles, long cycles. All of these different things that we are having and experiencing every month tell us so much about what's going on inside of us, both in our hormones and our ability to get pregnant. I made a comment that at the Super Bowl, I feel like if you asked a room of the men who are watching, and probably a lot of the women, what was going on? What's the sack? What's this play? Like, what is happening in football? So many people would be able to answer. It's like second nature. It's learned behavior. We know this sport. Yet if you ask the women what was going on with their cycle and all of these clues and what that meant, they would probably have no idea. And that is a huge problem. So that's why we break it all down today. This is like another mini course. We do so many of these where we tell so much information. So let's get started.
Okay, welcome back, everybody. We are going to be talking about, well, really, Dr. Leah is going to tell us all about how to decode your cycle and the types of symptoms and clues that you can look for in the way that your menstrual cycle presents that can be showing you signs and symptoms of different things going on deeper without necessarily doing the testing, or to help point you in a direction so that the testing you do choose to do, you're being the most efficient. Because sometimes, these huge lab panels, it's like, what are we actually looking for? What's the most likely diagnosis here? It is nice to be targeted, but sometimes you have no idea where you're looking. So after this episode, you will know so much more about what's normal, what's not about your period. Because maybe there's stuff going on that you're like, oh my God, I actually didn't even know that that's supposed to be the case. And it reminds me of a story of, do you remember that day in medical school in homeopathy when Dr. Jensen was telling us the story about, she was taking the case of a patient. It was a man, and he was talking about his day and how he wakes up in the morning. Every morning he wakes up and he vomits, and then he eats breakfast, brushes teeth, blah blah blah. And she was like, wait, what? And he was like, oh yeah, like I wake up and I puke and I blah. He had no idea. It's so funny now thinking about it, but he had no idea that that's not normal. Obviously that's a really extreme case, but sometimes women will, we normalize the idea of periods being horrible and terrible. And so a lot of women, I think, just deal with it, but it does not have to be that way. And it's actually not supposed to be horrible and terrible. So let's break it down. Why don't you just start us off? Let's start talking about all of the different things that women can tell from their cycles that would lead them to be investigators of, what's going on deeper in their body.
Yeah, absolutely. So we've done episodes on like the fifth vital sign, your period being that. But this, I really want to dive into seeing your cycle. And when I say your cycle, it's not just the part of the time that you're bleeding, your period, but your whole cycle. So from bleed to bleed, that's what I would call your whole cycle. And obviously that repeats every month, or it should. That's one clue, I'm not going to get into that specifically, but it should happen every month from the time you have your first period all the way until you go through menopause, really. And so that's a lot of months of this. And it's crazy to me that every time, so the Super Bowl just happened, and every time that we watch like a big sporting event, it blows my mind how much people know about, in my opinion, silly things, which if you're a huge football fan, I mean, no offense. It's just, we know so much about things like a game like football. Yet if you were at a football game and you asked, the majority of the men in the room, what's going on? What just happened? What is a sack? Like, what are all these things? They'd be able to tell you like it's second nature. Of course, like, how do you not know this? Yet if you ask the same group of women, what does spotting before your period mean? And what does it mean if you're having pain around ovulation? They'd be like, what? Like, how do we not know this information? This should be second nature. It should be what we just know. It should just be part of our culture and our education. And so it just irks me that it's not. And when we think about our cycle, our symptoms are talking to us. This is kind of a broken record. If you've listened to me and followed me a lot, I say this all the time, that your body's symptoms are intelligent. They are information and communication, and it is our job to learn how to decode them and know what they're saying. And so just like getting a report card where you say, okay, how am I doing in math? How am I doing in history? We are asking our body, how are you doing? Tell me. And it tells you through these clues. So even beyond blood testing, there are certain things that blood tests can tell us absolutely. And then there are other clues that we can say, as a woman listening to this, pay attention to what I'm sharing and say, oh, is this happening for me? Because that is a clue that my body is trying to tell me that this thing is off. And this can impact not only your hormones and how you feel, but also fertility, if that is something that you are, wanting in your life. So without further ado, the first one is one of my favorites, spotting before your period. And what does that mean? When your period arrives, the first day of full blood flow, like you have lots of blood coming out, that is your first day of your period. But if you are a person, which again, you might not know that this isn't normal, if you're like, oh no, like I have a little bit of spotting, a little bit of, speckles of blood, or just like really light bleeding for a day or two, and then I start bleeding. I can't tell you how many people tell me that. Like it's the most normal thing, because that's just what their period is like. And it's like, okay, well, that is just what your period is like. It does feel that that's normal for you, but that's a huge sign that you are not making enough progesterone. And that has a huge implication on your life, not only for how you feel, but if, like I said, you want to have a baby, you have to have enough progesterone, which is a key hormone that holds the embryo in the uterine lining. It allows your embryo to implant in the first place and prevents loss, okay? So like pregnancy loss. And so just a simple clue, like you having a day or two of light spotting before your full flow, can be a huge sign that you need to investigate this. And so with investigating, you want to absolutely test progesterone. This is one where I think labs are a savior. If you have these clues, then doing a mid-luteal phase test. So mid-luteal means when you have your period and you're done bleeding, about a week after that is when most women ovulate. It's ideal to track your ovulation. And if you don't know how to do that, there are lots of things that teach you how to do that. I have a whole course inside of my membership on that, but learn how to track your ovulation. And then a week after that, about 7 days, is what we consider mid-luteal phase, or it should be halfway between ovulation and when your next period comes. That is the luteal time of your cycle, from ovulation to next period. Halfway in between that is when progesterone should be high and robust. So that's typically when we do a blood test and test for that. And if it's low, that can lead to PMS. It can lead to sleep issues, mood issues, all sorts of hormonal imbalances. And most importantly, it can lead to fertility struggles and or pregnancy loss. So it's a huge, huge one.
Okay, question. What about people getting spotting like mid-luteally and not right before their period should come, but like a couple of days after ovulation, or sometime in that luteal phase where is it all the same thing to you when you hear that, or does it make you think of different stuff if the bleeding is closer to the ovulation side instead of closer to the period side?
If it's closer to ovulation side, I would think of infection. Like, do you have some sort of infection that's making what we call a friable cervix? Friable meaning it bleeds easily. So if you have any sort of cervical
Or like a polyp?
imbalance, yeah, or a polyp or something that would cause bleeding. So let's say you're having sex and you had a polyp that was kind of getting hit somehow, like if it was low right above your cervix, or if you had a cervical infection, or you had a vaginal polyp, not even a uterine polyp, or something that was causing bleeding, that's what I would think more so than just progesterone if it's closer to the ovulation side, just because there are other reasons why bleeding can happen. It's not only low progesterone. Why it's right before the period is because it's sort of sputtering out and your progesterone isn't high enough to hold that uterine lining until it's time to bleed. So that's why it sort of sputters out at the end. It can't quite hold it. But bleeding that's like way at a different time of your cycle could mean lots of other different things. So it's a good question,
It could
and
mean also
definitely
just,
something to investigate.
sorry, yeah, and just for those who are trying to get pregnant, it could be, I just thought of this, like an implantation bleeding, which
Yes. Yeah.
sometimes
Makes
people
sense.
have. I never have had this, but sometimes people have like a lot of obvious implantation bleeding. Did you ever get that? I don't know if you get it with IVF.
I don't think I remember having it. I used to when I was trying naturally for so long, I'd be like, oh, there's a little bit of brown, that must be
Mm.
implantation. I must be pregnant, so many times in my life. And who knows what it really was, because I don't know if we were really conceiving, even though I have been so nauseous and it did cross my mind. I'm like, what if there was some weird, miraculous healing? Because my husband's back is so much better. It's as if he doesn't even have like a back injury. I'm like, could you imagine if the stem cells that he did or something miraculously healed him and we are not using protection?
Yeah, that would be.
And we're doing a lot of fun stuff. So I was like, oh my God, could you imagine? And then he was like, what, how would I know? I'm like, no, it's literally, I would never cheat on you. So it is either a miraculous conception or not. But yeah, I have it. It has crossed my mind to take a pregnancy test because I've been so nauseous for like 4 days and it doesn't make any sense. But yeah,
I
normally no.
mean, come on. I have like a box of 50 of them if you want me to stop by your house.
I mean, that would be the craziest thing. Because in my mind, I'm like, you are completely infertile. Like, we will never need to use protection again. And how funny would that be? It would just be the total irony of our life.
Because really all it is
But
like this tube needs to regenerate so that there's not a
yeah.
blockage, right?
And he got stem cells. I'm like, could you imagine, like,
Yeah.
if the body's like, oh my gosh, we need to heal this. How silly. Let's take these stem cells and heal this thing. Yeah, well, we'll see. I
Well,
don't
what
think
day
so.
are
I
you?
don't have any I don't have any boob changes. I'm like about to get my period. So I'm waiting to see, okay, do I have any spotting? Do I have anything going on? I don't. But if I did, I would think progesterone and or thyroid. So thyroid is another thing that can be impacting, and thyroid and progesterone go together a lot. So if you don't have a healthy thyroid amount, then it can impact your progesterone. So that's another thing to think about. But no, I will keep you TBD, but I don't think I'm pregnant.
What
That would
about
be crazy.
speaking of thyroid, what about hyperthyroid? Does that affect progesterone?
Oh, that's a good question. Hyper, you mean high, like high?
Yeah, high thyroid, hyperthyroid. Because obviously, yeah, hypo does, but does
Mhm.
hyper?
I don't think hyper would as much,
I
because
don't
when
think
you
so
think of
either, but yeah.
yeah, when you think of thyroid, it's your metabolism, it's growth of things, it's everything is revved up. So where low thyroid affects progesterone, you don't have enough things to build stuff. Like you can think of it like that. You don't have enough nutrients to do certain things. Oftentimes it can steal certain things, like the progesterone steal is a thing that can happen with stress as well. So with hyperthyroid, I don't think it would be as much, but if it was really high hyperthyroid, there's still some significant imbalance that could potentially impact other things. I'd have to look and see if there's something specific around progesterone, but um, yeah, I don't know. Yeah, if that would be a thing.
Okay.
I tend to be on the higher side, but not hyperthyroid. Yeah. Okay. Number 2 is light periods. So light or short periods. So a lot of women, again, they're like, oh, I only bleed for 1, maybe 2 days, and they love it. They think it's really great. And that isn't great. It's not a great sign of robust estrogen. Estrogen is a hormone that helps us feel sensual and feminine, and it helps build up things. It's very needed for fertility. And when we have estrogen at the beginning part of the cycle, that is what's actually building the lining that will become the blood that we bleed during our period. So
Mhm.
when we have a period, it's actually reflective of the cycle prior. It's reflective of the hormones that were happening the month before we actually bleed. Our period is really the end rather than the beginning, but that's how we classify it because it's just how we do it. So basically, a short, light bleed would indicate lower estrogen, a thin uterine lining. This can come if you've been on birth control and your system is having a hard time getting back online. This can happen if you have what's called hypothalamic amenorrhea or hypothalamic suppression. Amenorrhea means no period. So if you're getting some period, you wouldn't be considered somebody who has amenorrhea. But basically, the brain talking to the ovaries, that gets disrupted. And the most common cause for that is undernourishment, so not eating enough, or overexercise. So
Yeah.
this I see a lot in eating disorder patients and or athletes who are exercising a lot, maybe did their whole life as teenagers or continue to do so and are not nourishing themselves enough for that output, if that
Y-
makes sense.
Yeah, specifically like runners. I think it's a lot of the cardio, marathoners, that kind of thing that they
Yes.
tend to, or, gymnasts, ballerinas, some people who have to maintain a very sleek, slim profile, but we need fat as women for the whole hormonal system to work properly. And, you always say this analogy, it's like the body will either choose to deal with stress or to be fertile, and it can't really do both. And there
Mm-hmm.
is that, there's a certain level of stress that your body perceives when it's that high of um, exercise output. There's a fine balance. I know people will make their careers out of these things, and there's still a cost. So, as a
Mm-hmm.
normal Joe Schmo person, unless you're like an Olympian, we don't need to be pushing our bodies so bad that you don't get a period. Okay, like that is
Right.
definitely a warning sign you're going a little too hard in the paint if you're not getting a cycle.
Did you know that while 97% of women take a prenatal vitamin, over 95% are still deficient? That's why I love recommending Needed's prenatal. Unlike most prenatals, Needed doses nutrients in the right forms and amounts that go above and beyond to really support both mama and baby. I actually worked with Needed for years. We spent over 3 years researching, working with practitioners, and really intentionally choosing every single nutrient form and dosage that's put into the prenatal. And now we have the data to back it up. In an IRB study, they found that the women who took the Needed prenatal had higher blood levels of key nutrients like vitamin B6, vitamin D, vitamin B12, riboflavin, vitamin K2, and selenium, compared to women who are taking a regular prenatal. Even more powerful, only the Needed group had significant amounts of vitamin D in their system, which is essential for supporting the immune system, bone development, blood sugar, blood pressure regulation, and so much more. This study reinforces what we've known for a long time, that real nourishment really makes a difference, and the proper nutrients support fertility, pregnancy, and baby's health. Needed isn't just aiming for adequacy, they're supporting what's possible. No matter where you are along your fertility or pregnancy journey, Needed is what I recommend. Head to thisisneeded.com and use code HEALTHYMOTHER to save 20% on your first subscription order. Again, head to thisisneeded.com and use code HEALTHYMOTHER to save 20%. Okay, now back to the show. Yeah, that's a big clue. If someone was like, well, how do I know if I'm healthy? How do I know if I have fertility? You have a good bleed. This isn't something that you want to shy away from, and it's not a good thing to have that. Also looking at your nutrient status. So this is where maybe doing some estrogen testing and nutrient testing could be helpful. But at the end of the day, the remedy for this is eat more. Like,
Yeah.
eat more and exercise less and heal your nervous system, because there's been basically a shut off, like you said, of it's a light switch. And stress, support, and fertility are the opposite ends of the light switch. And you have to tell your body, hey, we can turn off that stress switch and shift it over to fertility. And that can take time, and it can be really hard. And especially if disordered eating is a part of the picture, you can't just tell women to eat more if that's going on.
And like, what
There's,
about the woman who's not super thin or an athlete and is still having really, really light cycles? And like overall, you look at them and it wouldn't fit the picture. They don't seem super chronically stressed.
Mhm.
Um, they're not working out maybe like at all, or a very normal amount, and they have a normal amount of body fat. Are we thinking it's just nutrition at that point? Like a
Yeah, I would say like a nutrient deficiency. So we see this a lot in kids. There are a lot of obese children who are completely malnourished, which
Mhm.
is crazy to think, but calories does not equal nourishment. And just because you have excess weight or fat does not mean that your body's getting all the nutrients that it needs to build things like estrogen, or to, again, signal the body that you are fertile and optimal, that comes from the vitamins and minerals that are in the foods that we eat, not just pure calories. So someone could absolutely be overweight and or obese and still have malnourishment on a big, big level. So yeah, it's a good point. Yeah, so getting the right nutrition, not just eating bonbons.
Yeah.
Okay, number 3 is heavy bleeding. So this would be the opposite. So if you're like, oh yeah, like I'm bleeding through super tampons all day long, multiples of them for many days, just like flooding, this is where we're looking at an estrogen dominance picture. So you're getting too much estrogen. So again, it's quite simple if you think about physiology. If you just know where things come from, you're like, okay, I have a light period, that means lower estrogen. If I have a really heavy period, that means higher estrogen. This can also come from growths like fibroids, adenomyosis, things where like not bulbs of blood, but like blood can build up in these areas and then they can be irritated during your period and cause extra gushes of blood that is more than just your uterine lining. It could be that there's a polyp or some other thing that is leading to that. Typically, though, fibroids, polyps, all of these things tend to grow more in an estrogen dominant body because estrogen is what makes things grow. And when we talk about estrogen dominance, there is true estrogen dominance, meaning you actually have high estrogen. And then there is relative estrogen dominance where you have low progesterone. So estrogen and progesterone sort of counter each other and they need to be in balance. They're the yin to the yang or whatever. So you can absolutely have normal estrogen levels. I'm saying air quotes for those who can't see me, normal, but low progesterone. And then that creates a relative estrogen dominance in the body where there's way more estrogen that's unopposed than is good, right? So you can have pure high estrogen or normal estrogen with low progesterone that can both create this environment. You can also have a lot of inflammation. So estrogen is a builder. If we think about the roles that our hormones all play, estrogen is a builder. So is thyroid. Thyroid and estrogen are builders. And this is why higher estrogen is implicated in a lot of growth conditions, endometriosis, fibroids, cancer. We see a lot of estrogen dominance in those conditions because estrogen makes things grow. That's why we need estrogen when we're trying to get pregnant. Like the estrogen grows the uterine lining and it helps grow the baby. Like it is the growth hormone.
I love estrogen. I feel like I should check next time that I'm like, not breastfeeding and not pregnant because I think I must have low estrogen. There's like no way. Although I have very normal, like if anything, kind of on the heavier side periods. I don't know, but like I love being pregnant and I think it's all the growth from estrogen. It's also progesterone, but anyway.
Yeah, and we've talked about this before. You can look at someone's physique and sort of tell how much certain hormones were at play during your development.
No
not only in
boobs.
utero, but also in your puberty years, because estrogen is what makes things grow, aka your boobs, your hair, your nails. It is more of that classic feminine look comes from estrogen, whereas more of like the rectangular shape and acne and more aggression, like these are more testosterone pictures. So not to say that every woman who doesn't have boobs has no estrogen. That's not true. Like there's
no, because I don't have testosterone either.
There's genetics at play and stuff like that, but it is just something to know. And it's not always a good thing. Like a lot of women like me as a teenager who had huge boobs right away, there is some genetic component to that. But I had way high estrogen dominance. I mean, I was like bleeding out all the time, literally just like through my tampons, through my pads, through my clothes all day at school. I had huge boobs, but it wasn't like a good thing because I was getting too much estrogen, whether it was from toxin exposure, my own genetics of having a hard time getting rid of the estrogen. So sometimes it's because it's coming in. Sometimes it's because you can't get it out. So that's another thing to look at. And you can dive deep into all of this looking at genes. I know genetically I make something called COMT. I have an issue with making that enzyme, COMT, some people call it, and it is involved in detoxing estrogen. So you can see on a Dutch test if you have COMT issues, or you can do genetic testing. And it's, again, these are things that you can investigate, but you don't necessarily have to. If you have heavy periods, huge boobs, most likely you have high estrogen. So something to look into. And this is where doing a pelvic ultrasound and looking for any sort of growths or doing any sort of detox support would be really, really helpful.
Okie doke.
All right, so the next one is pain at ovulation. This is called Mittelschmerz, which I think is such a funny name. And this absolutely can be normal, but I get this question a lot from women. They're like, I'm having pain, but it's at ovulation, not at my period. So if it's just a little bit, there can be pain that happens when the egg basically ruptures out of the follicle during ovulation. So this would be about 2 weeks after your period starts for most women. But if this is severe or prolonged, this can definitely be a red flag. So you want to pay attention to this. What could this mean? It could mean ovarian cysts. You could have a cyst going on. You could have endometriosis. So if you have endometriosis, which is where the uterine tissue is growing outside of where it should on that uterine lining, and it can wrap itself around the ovaries, it can be everywhere, honestly, that can absolutely lead to pain during anytime there's like movement or jarring or really anything happening at all in a person with endometriosis, there can be pain. So you can have pain with bowel movements, you can have pain with sex, you can have pain with anything. So that's another thing. You could also just have inflammation, pelvic inflammation can cause extra pain, adhesions, other things like that. And that is what can cause extreme pain. So the next one is PMS. This is mood swings, anxiety, rage, sadness, just feeling really off before your period. Very common as well. And again, whenever someone tells me this, anytime I do an intake with a patient or a client and they're telling me their symptoms, right away I'm just like, oop, this, like you have low estrogen, high testosterone, low progesterone. Like I just know it so quickly because these clues are just so obvious. So I'm teaching that to you so you can start to pay attention to that. But this is another big sign of low progesterone. It can absolutely be a sign of progesterone and or progesterone irregularity, where maybe it's up and down and it's just not steady, which can cause this crazy mood shift. You can also have estrogen dominance. Basically, a lot of women's suffering comes from the fact that you don't have enough progesterone and you have too much estrogen. It's just kind of what happens. You can absolutely have blood sugar instability. Blood sugar instability means that you're having really big ups and downs of insulin and blood glucose. So working on supporting your daily breakfast, having lots of fat and protein, making sure that your adrenals are also healthy can be a big factor as well with keeping hormones steady. But this is a sign that something's going on. I also see nutrient deficiencies playing a huge role, especially in PMDD, which is even more severe form of PMS. So magnesium, B6 status, these are all really important. But what's ironic is that magnesium and vitamin B6 are two of the biggest nutrients needed to make progesterone. Everything's connected. So that is another thing. If you are struggling with PMS and all of these different things, then looking at these hormones and understanding how to support them. Now, a lot of people say, okay, well, my progesterone is low. Clearly, I'm having all these symptoms, but what do I do about it? I have a whole course inside of my membership on this, but at the end of the day, unfortunately, with progesterone, there are often some big root causes to this. One of them can be inflammation. Inflammation, where's it coming from? Is it foods you're eating? Are you eating gluten, dairy, corn, sugar, alcohol, something that is inflaming you because of your diet? Do you have a microbiome issue? You have never been well since you went to Southeast India and ate the food off the food cart. I can't tell you how many times, you guys. It's like, I am all about traveling, but if you got sick while traveling and you've never been the same since, most likely you have a parasite, some bad bacteria, something that is impacting you, and I see it all the time.
And it's fixable. It's like, it's not the
Yes.
end of your life. It's like, you just have to treat it.
Yeah, exactly. But people just don't make the connection. I do a timeline intake with people, and it's just not even something in their mind that they would ever have put two and two together that, oh my gosh, yeah, it was about a year after I got back from India that I developed Hashimoto's. I never even thought about that, they just don't make that connection.
Or moving into a moldy house or something where
Yes,
there's.
totally. Exactly. So hidden infections are Lyme, mold, all of these things can lead to inflammation. Stress is another big one. So these are huge, right? It's not easy. Yes, you can just take progesterone. And in fertility, I do recommend that a lot because we're dealing with high stakes. And if you get pregnant and you don't have enough progesterone, we do not have time and we cannot, address your microbiome, your stress, your nutrient deficiencies all in, a week before you lose the baby. So there is a time when progesterone, taking it actually is the best thing. But if you have time and you're really wanting to work on the root cause, these are clues and symptoms that tell you something is going on. So also working on your stress, your nervous system, and your nutrients, right? So inflammation, stress, nervous system, and nutrients are kind of the root causes of progesterone. And there's herbs and different things you can do like Vitex and all of that. But herbs are beautiful, but they're not getting to the root cause. They can absolutely support with symptom management, and they can support. We use herbs to treat the root cause. Like there are herbs that I would give if you had bad bacteria in your gut or a parasite or, something. But at the end of the day, using natural medicine, just like you use conventional medicine, is not the same as getting to the root cause, if that makes sense.
Electrolytes are trending, yes, but they have been in need of our human bodies for all of time. And if you're drinking another popular and delicious salty electrolyte, here's why you should be drinking Relight instead. First of all, have you ever considered the salt source of these other brands? Because most of them just use table salt. Yeah, table salt. You don't want that. Redmond's Relight Powders uses their unrefined ancient sea salt that they mine in Utah. This salt source contains 60 plus trace minerals along with calcium, chloride, potassium, and magnesium in 2 different forms, glycinate and malate. The minerals that they use in the Relight powders are all in the appropriate proportions and forms too. The metabolic needs of pregnancy, healing postpartum, and milk making require more minerals than in other times of your life. Pregnancy itself demands huge increases in your blood volume, which takes, more minerals. Relight is the perfect blend to be sipping during your pregnancy or during your labor even, and especially while you're breastfeeding. It tastes amazing, and my favorite flavors oscillate between mixed berry, lemon lime, and the strawberry lemonade. But you can try a sample pack and try all the flavors for yourself and see what you think. Use code HEALTHYMOTHER to save 15% on your entire Redmond order. That includes their OG sea salt, other seasonings, bentonite clays, toothpaste, and more. Okay, love this. And what about when people are getting mood swings or having really just noticeable mood changes and it's right after ovulation? Because do you remember maybe like 6 months ago, that was happening to me a lot. I was having maybe like not the day of ovulation, not the day after, but like 2 days after I ovulated, I was having a very noticeable, really bad day, like every single month. And maybe it was like 24, maybe 48 hours. And then I was back up to normal. And I don't like get pre-period PMS, but it was happening right after my ovulation. I was like, what the heck is going on? So let's talk about that really quick in case that's happening for people.
It could be anytime there is mood, anything, we always think, are there sharp ups and downs of a hormone? Is usually the root of that. Well, that is hormonal imbalance is like a subroot, right? That is like why it's sort of happening, but the hormones are doing that for another reason. But if we just talk about it, if we think about it, I don't know exactly what was going on with you. However, if we think about it and the way the cycle works, you have a surge of estrogen that is what triggers LH, which is what triggers ovulation. You also have surges of testosterone around that same time. So estrogen and testosterone sort of track together, and they both surge around ovulation, which is why libido is higher around ovulation, because we have high estrogen and testosterone, which are the 2 hormones involved in wanting to have sex. And then what should happen is that you are then making progesterone right away after that. So what could have happened is that you were having a little bit of progesterone production issue. So you were having these surges of estrogen and testosterone, but you weren't having enough progesterone to counter that. And so when the progesterone should have been higher to kind of calm that down, you're maybe having an issue with that. And or for some reason, you were having some extra surging of estrogen or testosterone. If your mood was very angry and irritable,
yes,
I would think testosterone.
Not like weepy. I wasn't like, I was just like, I would be like a huge bitch to my family for like a day and a half. And I'm like, what is going on? Like very, very noticeable.
Yeah, it sounds like testosterone. And I know you've been on a lot of different supplements and doing all sorts of things, and who knows what would have like shifted around, but that's a classic higher testosterone picture. So it could have just been something in you that was triggering a little bit more of a surge of testosterone. I mean, I've seen people where they just increase testosterone a tiny amount and are ripping people's heads off. I mean,
Yeah.
this is why, roidy men get all of these bad raps of like road rage and I'm going to like rip your head apart, because testosterone makes you so irritable when it is out of balance. And for a woman, especially who's not used to that or is having excess amounts of that, it can feel really disorienting because it's just not our nature.
Well, and for me, like whatever was going on, I really wish I would have done a 30-day Dutch or something to see,
Hmm.
because then all of a sudden, like whatever spike was happening, and then it was just gone and it would resolve and I was normal again. But it just kept happening cycle after cycle. Anyway, whatever. Enough about me. I just wanted to ask in case people are having those
Yeah.
sorts of symptoms around ovulation rather than around their period. I
Yeah.
don't think it's
There's a
as common at
surge.
all.
Yeah. Yeah. There's a surge of hormones around then. So that's what I would think. Either, again, the lack of the progesterone to support it, or in your case, I would bet to guess it was like surges of testosterone for whatever reason. We don't know. That could be
Okay.
the investigation, right? Okay, the next clue is no cervical mucus or a very dry cycle. And so it is normal for a woman around ovulation, the few days before and up until ovulation, to have cervical mucus. And people hate the word mucus, they hate the word moist. I get it.
They hate the word
Everyone's like,
discharge though too. So it's like, what are we gonna say?
there is stuff that comes out of your vagina. Like, it is just the reality of it. And it's not gross, it's actually a beautiful thing. Tracking your cervical mucus is a really effective way to actually track ovulation to see if you are ovulating. And if you are not making enough, so it starts creamy like lotion and then it turns into egg whitey. So if you've ever cracked an egg and the egg white part is kind of stretching and you could put it between your fingers and it sticks together and it stretches and it's see-through and it's clear, that is what is more fertile mucus or discharge. Whatever, I don't know, it needs another word. But that, if that's not happening or there's a tiny amount, that is another clue that you either are having low estrogen, and it can not only just be systemic estrogen, but low vaginal estrogen. So I talked about a little bit about this during the painful sex episode about how you can have lack of hormones at the actual tissue level, which can cause painful sex for women at the opening. And so that could be part of it, is it's actual tissue low estrogen or systemically low, systemic meaning all over the body. Thyroid imbalances can lead to this, dehydration. If you've been using antihistamines, so maybe you're a person who has allergies, so you're taking antihistamines a lot, this can absolutely do it. Post-birth control can do it. There's a lot of different things, lack of, essential fatty acids or just lack of fat in general. There are a lot of imbalances that can lead to this, but it's absolutely a factor, especially for fertility.
Yeah,
So,
I think, and just know for those that are pregnant, I always get this question that people will have like copious amounts of vaginal discharge throughout their pregnancies, off and on, but it can be a really stark difference hitting immediately at the first trimester. And people are like, what is happening? In the absence of other symptoms, like, so I know this is like the opposite of your point here. This is about too much or, a lot of discharge or mucus. In the
mm-hmm.
absence of pain, itching, burning, weird smells, weird colors, it can just be normal because of all of the estrogen, the quick
Yes.
ramp up of estrogen. So it's like on the flip side, you're seeing how physiologically this happens in the reverse. And if you're not having it,
Mm-hmm.
don't worry. I mean, it's just very common at some point in the pregnancy for people to be like, what? I almost have to wear a like
Mm-hmm.
a panty liner,
Yeah.
And yeah, if it smells funky or you're having symptoms, it could be yeast, it could be BV. So you need to go get that checked out. But if it's not causing
Yeah.
you any issues, it's likely just a lot of
Mm-hmm.
estrogen.
Yeah. Yeah. So the lack of it means a lack of estrogen, right? These are clues where you're like, oh, I don't even have to check my hormones. At this point, I already know what my cycles hormones look like. Okay. So the next point is very long cycles. So we've talked about short periods, long, heavy periods. That's the bleeding part. When I say a long cycle, that means from bleed to bleed. So from the first period to your next period, for a lot of women, that's the classic 28 days. That is not actually very common for women to have 28-day cycles. It can vary, but if you are having cycles greater than 35 days or they're irregular, so sometimes I'm having a cycle that's 30 days, sometimes 35, sometimes 41, sometimes 27, like that's irregular cycles. But long cycles typically means that you're not ovulating on time. Your ovulation is delayed. And we see this a lot in PCOS, polycystic ovarian syndrome. This is an imbalance that we see in women, and it can absolutely disrupt ovulation. We see this a lot in blood sugar issues. PCOS, the root of PCOS, a lot of times is blood sugar dysregulation. And this absolutely can affect egg quality. It can affect fertility in a big way. One, because you're not ovulating or you don't know when you're ovulating, or it's a clue that you don't have healthy hormonal patterns that are what we really want for fertility. So, some things to investigate if this is happening for you, if you're having long cycles, checking something like the LH to FSH ratio. LH and FSH are two hormones that come from the brain and talk to the ovaries. And we want to check those around day 3 or 4 of your cycle. So, again, day 1 is the first day of bleeding. Day 3 or 4 is when you would check these. If your LH is 2 to 3 times higher than your FSH at that time, that can be a clue that you are struggling with PCOS. And basically, what's happening is your LH, the thing that triggers ovulation, is already too high early on in your cycle. So there's never a jump from low to high, which is what triggers ovulation. If your LH is high, you are not going to get a low to high jump to trigger ovulation. So it delays and delays and delays. You can also have insulin resistance. So checking things like fasting insulin and glucose are really important. Looking at your androgen levels, things like testosterone, DHEAS, if these are high, that again tells us that your body's having a hard time with your ovaries and with insulin signaling and all of that. And these are absolutely things that you can improve. This is not a death sentence. This is not like, oh my gosh, you are never going to be able to get pregnant or you're never going to have a normal, healthy cycle. You just have to understand and get to your root causes of that. But it's a very big clue if you have long cycles like that, that something's going on there.
Okay, and I
On the
do just
flip
want to
side,
say this isn't like
yeah.
what you're talking about, but if you normally have some other length of cycle and then you have a random long cycle. Well, first of all, there is some sort of like a loose statistic that about once a year, so once one cycle out of the 12 of a year, women will have a randomly longer cycle than
Mm.
like normal. And that's sort of an average. But here's the thing. If you are not using any birth control and just
Yep.
going off of, well, I think I ovulate normally around day 13, 14. So, oh, now I'm day 16, 17. I'm totally fine. And now we're having sperm and vagina sex. And you actually didn't ovulate until day 18 because this was your one random cycle where you were going to have a long one. Um, you could be getting pregnant. So here's the thing that I think a lot of people, for some reason, I got into an argument with like someone who should have known this, like maybe a reproductive specialist or something on Instagram, who was talking about how it's what she was saying was that it's the luteal phase that's variable and up for change based on like stress and medications and things. And no, it's not. It's the follicular phase that is up for change. And so like if you, even if this is not your one random um longer cycle in the year, but like you went to Hawaii and or you went to Europe and you had like a big circadian rhythm change and there was stress and there was sickness or there was a new medication or whatever, your body just may not, all of those signals that you were just talking about with LH, FSH, etc., like everything can just get a little bit shifted. And so
Mm-hmm.
it will delay your ovulation. Once you ovulate, it's a pretty clockwork pattern between like, 12 and 14 days of a luteal phase. But
Mm-hmm.
the follicular phase is really can be super long and variable or
Yeah.
on the shorter side. But just know that because if you're cycle tracking, then you need to see your confirmed high BBT and the progesterone shift of, oh, that's for sure ovulation. I definitely ovulated then because I had this happen to me and I was on that Lyme disease protocol. And so my hormones were getting all messed up for sure. Which was normal. And, my doctor did tell me it was going to happen. But for a minute there, you and I were both thinking like, am I having perimenopause symptoms? But
I
I don't
know.
think I was. I, it could have been, but I think it was just related to my supplements. But either way, I had one random cycle where I didn't ovulate until day 21. You guys, that's never happened to me in my life that I was aware of. And because I had an aura ring, I was watching and watching and watching, and I was like, wait, did I not ovulate? And so I was freaking out because it would have been probably my first anovulatory cycle outside of like, breastfeeding, some sort of a situation where that can happen. And then randomly there it goes. Like, oh, okay, there's my ovulation. So strange. And I
Crazy.
totally could have gotten pregnant had I not been more careful for that. So I just wanted to say that. I have a confession to make that will probably knock the socks off of some of you crunchy moms. And please don't make fun of me for this, but listen, I don't make bone broth, okay? I don't. Sue me. I like to buy it instead. And maybe one day I'll get my act together, but for now I rely on brands like Fond to make real, actual bone broth from scratch, just the way that I would at home. Fond uses actual bones, not just rehydrated powders like a lot of brands. And their animals are verified regenerative, 100% grass-fed or pasture-raised, and the vegetables that they use are organic. And as you've heard us talk about in the past, there are certain foods, like bone broth, that have been used in pregnant and postpartum populations throughout human history, preferentially more so in those populations, due to their healing benefits on the body. So providing the connective tissue nutrition or optimal gut health and healing so that our bodies can make new life healthfully. Fond has several different flavors to choose from in beef and chicken broth, from unflavored to things like the classic garlic and lemon, to even a turmeric and black pepper with added health benefits. But then they also have foundational fats like tallow and lard as well. Make your family building season easy and choose Fond for your shelf-stable glass bottled bone broths that you can use in soups, with rice, or just for sipping like I do because they taste that good. Check the link in the show notes or go to fondregenerative.com and use code HAAM HAM for 10% off and nourish yourself with Fond.
Yeah, it's such a good point. Yeah, usually with a lot of tracking outside of cervical mucus tracking, which would be hard to track if yours is short or low, you often don't know you ovulated until you've ovulated. It's like in retrospect that you realize. So it is tricky and important to find a good form of birth control that works for you, especially if that's not your goal right now. Or even if you are trying to conceive, but you're working on a protocol to heal your gut or whatever, there are times even when people who want babies are trying not to conceive. So such a good point. I'm so glad you said that. And that leads me to the next one, which is a short cycle. And it is, like you said, usually the follicular phase is the variable that changes drastically, because that is basically from bleed to ovulation. And that window could be 5 days, it could be 30 days. I mean, it can change a lot based on when you ovulate. For most women, this does tend to come around day 12 to 18, somewhere in there, with 14 being the classic time of ovulation. But yeah, you can't just use a calendar as a form of, oh, this is 14 days from when my period started. That's when I'm going to ovulate because that's what they said. It's like, nope, you could be anywhere in there and it could change each cycle. So it's really important to watch your own cycle. Having a short follicular phase can be from low egg count, and you're getting early ovulation because your egg count is low, and it triggers the brain to basically trigger ovulation too soon. So it's something we can see in women who are a little bit older, who are trying to conceive. They can sometimes have these shorter cycles. This is the time, though, where there are certain circumstances where that luteal phase can be short. This is not as common. We call this a luteal phase defect, and this is always from low progesterone. Short luteal phase is from low progesterone because it basically means that when you ovulate, the progesterone is made, and it is helping the corpus luteum stick around. And that corpus luteum basically has a 14-day detonation destiny. It's like you are made and you are here to be on this earth for 14 days, unless pregnancy happens and then a little hormone called HCG, which is the hormone that we test on a pregnancy test, is around, and then that will keep you alive. Unless you have HCG around, you are set to detonate after 14 days. Like, that is literally what the physiology of the corpus luteum is, which is why it doesn't change very much, and why the follicular phase is more the variable in cycle length. However, the corpus luteum is making progesterone. And so if you have a really poor quality follicle and a poor quality corpus luteum and low progesterone, then you don't have enough progesterone and your corpus luteum isn't healthy enough to live out to be 14 days, like how it's supposed to be destined to. And so it's weak and feeble, and it's like dying early. Like, I imagine this little old lady that's like, I can't make it. And she just dies too soon. And so we would call that a luteal phase defect, and it's from low progesterone, but it's from poor follicle quality. It's from all of these things, right? And so that can sometimes shorten a luteal phase to like 10 days. but it is very unlikely that that varies much more than that. And again, if this is happening for you, this is why tracking your ovulation is important, knowing what your follicular and your luteal phase are. And if you have a short cycle, I would absolutely check AMH, anti-Müllerian hormone, to see your egg count, because it could be a sign, even if you're younger, that you have a premature ovarian insufficiency. Basically, that means low egg count too early. You're too young for this, but your eggs are lowering, like you have too low of an egg count for your age. Or if you know that you're in the window of having lower egg count, you know, your late 30s, early 40s, then this is a sign that you might not be the person that can take 5 years to try naturally. Like if wanting a baby is on your heart, you might need to, you know, get help sooner. So this is a great clue, because you as a person are sitting here being like, oh my gosh, I know the length of my cycle. I notice that it's getting shorter. I know when I ovulate, this seems like I have either a short follicular phase or a short luteal phase. I should probably check my egg count. I should probably make different decisions in my life, you know? So this is a great clue. Like, you don't even need the doctor for this. You can do this all by yourself, which is so empowering. Okay. There are just 3 more things that I'll talk about briefly. The next one is just brown blood at the beginning or end of your period. People ask me this a lot. That basically just means old oxidized blood. Fresh blood is bright red. So this could be sluggish uterine lining. This could be a progesterone issue. It could be a sign of inflammation. So I would potentially do some microbiome testing of your vaginal microbiome, making sure there's no imbalance there, doing some womb massage and castor oil packs, as long as you're not pregnant, and just some things to help improve blood flow, because it can kind of be a sign of stagnation. If you have ever been to an acupuncturist or Chinese medicine therapist, they talk a lot about blood stagnation and how you want to improve blood flow, because that's a big part of just having a healthy fertility and hormonal system. And so old blood, brown blood, can definitely be a sign of that stagnation. Okay, last 2 is severe cramping. So painful periods. If you're having severe cramping, this is not normal. We should not have extremely painful period. It is okay to have slight discomfort on like the first day of your period, but beyond that, extreme pain, doubled over pain. I can't go to work. I have to lay in bed all day with an ice pack or a hot pad. This is not normal. It typically means high prostaglandins. Prostaglandins are the thing that are present that contract the uterus to make the blood come out, right? We have to have something that triggers a period, and that's a prostaglandin. But prostaglandins can also be high in times of inflammation. I've talked a lot about inflammation in this episode. Inflammation can come from lots of places. It can come from microbiome imbalances. Bad bacteria, parasites, those kind of things cause their own form of inflammation. You can have inflammation from certain foods that you're eating, processed or packaged foods, you know, a lot of unhealthy fats, or the foods like high sugar, alcohol. These naturally just increase prostaglandins. Estrogen makes more prostaglandins. This is, again, why estrogen builds stuff and it can create inflammation. So if you have estrogen dominance, it can lead to this. Endometriosis and adenomyosis, so growths of these inflammatory sort, can absolutely be a main cause of painful periods. Now, I have helped women completely resolve their painful periods by just getting food and stress and their microbiome back in balance. Yet, if you do all of those things and it's still happening, more than likely you have endometriosis, and it's something to investigate and not just let go, especially if you're trying to conceive and you're like years and years, you know, and you're trying to conceive, but you're having really painful periods. Like, this is a huge clue. Your body is telling you something's wrong.
Okay, and
You
just
can absolutely support. Yeah.
correct me if I'm wrong, but there is no blood test that indicates endometriosis at this point in time, right?
Correct. There is a company that we met. My husband has a startup, and so we were in a funding round of people trying to whatever, and they are a company who is working on a blood test from your period blood that can potentially test for endo, which when I heard all the pitches, I was like, oh, this is it. This is the one. And the company that won was literally a peanut butter whiskey company. And I'm like, you are kidding. Like, this is what everyone got together and was like, this is what we're going to fund. And I'm like, you mother, like, this
peanut butter whiskey sounds gross.
And there's already so many brands doing it. It's just, you guys, getting funding in the startup world is so backwards and bananas. It's just crazy. And I'm sitting there looking at this company. I think it's called Hera is the company. And I was like, this is going to change everything, but I know it because it's the space I'm in and how needed it is and how
Yeah.
revolutionary that would be. So I don't know where they're at right now with their testing
What were
and
they
getting it to
testing
market.
in the blood? Like some kind of cytokine? That's what I would imagine is like there's a
Yes.
specific cytokine that's how we test. Because otherwise, how would
I
you know?
They paired with a scientist who was a cancer doctor because endo it really functions more like cancer. It is not cancer, but it functions like cancer. And so there was some clue that he could find because we have ways to test for cancer. There are certain cancer markers that you can test in the blood and be like, oh, you have like a risk factor or you have something going on. It was something like that. I don't know
Mm.
exactly. I haven't dove into the science, but so amazing. Currently, no, there is no blood test, and even ultrasounds don't catch it. You can do an MRI with contrast, and certain doctors are trained to read that to just see roughly if you have it. But pure diagnosis is from a laparoscopic surgery where they have to go in surgically and look for it. So it's missed all the time.
I
It's
am
all the
not
time.
like I'm not in the endo client world, but it seems to me the number of situations I've heard where people had those laparoscopic sort of like exploratory, let's just see. And then the doctors go, and then what is reported afterwards is that it was like an absolute mess of severe endometriosis. And the woman had no
Mm.
clue and was just like dealing with these symptoms for so long. And it's like, this is crazy. There has to be better care for this situation. And then, they were able to cut it all out and or make a plan to get it all excised because it's such a big deal.
It is a big
Anyway,
deal, and it plays a huge role in your quality of life and in fertility. So there should be so much more about it. I mean, I think I maybe have endo. I have not had painful periods since I became pregnant, but I had painful periods my whole life. My sister has severe endo, and I'm just like, and when I'm done breastfeeding, is it going to come back? I hope not, knock on wood. But if my period pain comes back, I am going to go get it investigated because I know now I didn't, that from the age of 12 until I got pregnant, painful periods, like something's not right. And I ate well, I did all of that. So it definitely is something on my mind that it can go silent during pregnancy and postpartum for some women. And maybe it cured it and maybe it'll come back. I don't know. Okay, last thing is breast changes. We see this a lot too. So your cycle is not just about your bleeding and how you're feeling, but if your boobs change over your cycle, that can also be a sign of certain things. Again, estrogen dominance, low progesterone. A lot of these basically mean that your body wants to have a good amount of estrogen, not too much, but definitely enough progesterone. You can also have high prolactin. So a lot of fluid can be retained in your breasts if you have high prolactin, which could impact your fertility. So that is a sign if you're having really swollen, heavy breasts, throughout your cycle, especially as you get closer to your period, that's something to look for. You can also have more prostaglandins. Those inflammatory things that cause painful periods can also lead to swollen and painful breasts. The other thing I didn't mention is like lumps in your breasts, like fibrocystic breasts. And just as like a fun little note for people who tend to have that, I have seen amazing results from electrolymphatic drainage. So your lymph is how you kind of move junk throughout your body, and your breast tissues get a lot of lymph stagnation. And we don't massage our breasts very often. They don't get massaged with the massage therapist unless you have a really special one,
and they
like
sit in
we
like a
just,
bra where they don't move or
yeah,
bounce or jiggle
we
from
don't get a
walking
lot of
even.
that. And so you can do lymphatic drainage, of your own breast tissue, dry brushing movement, but electrolymphatics is a type of therapy where I don't know exactly how it works, but it's kind of shooting electrical pulses and they rub it over your boobs. I used to have really bad fibrocystic breasts. It doesn't hurt. I mean, it kind of stings a little bit sometimes, but um, I have seen with myself and with clients huge changes in fibrocystic breast tissue with getting adequate iodine and doing electrolymphatic drainage. So if that is you, those two things, iodine and electrolymphatic drainage, are like, whoop, so good. So that's a little nugget.
Okay, well, there you go. Where did you get that done though?
In San Diego at
Oh,
the Living Water Colonic Institute.
oh, is that a colonic place?
A lot of places that do colonics and sauna and all of those places will have them. Not always, but
Okay.
yeah, just you can find it. Electrolymphatic drainage is what it's called.
Okay,
Yeah. So
awesome. Well, this
basically,
was, yeah, go ahead.
that was just a lot. It was a lot for you guys. Is kind of what we do. We just teach you a course every month, every week on this
I
podcast.
know. I know. It's because we don't
Crazy.
know how to stop ourselves. Like sometimes I listen to other people's podcasts and they're really good at giving just enough information that you're intrigued and maybe you learn a little bit, but then you like have to do their course in order to learn the rest of it. And you and I will sometimes try to do that because, I mean, to be honest, we do love talking about stuff. We do love education. And this is still like the reason we do this is to drive traffic to our own offers and businesses and
Mhm.
things. And the podcast itself has a revenue stream, you know, whatever. It's not huge. It would be better, great
No.
if it was better. And a lot of people use a podcast specifically and only as marketing, which is wild to me. I don't know how on earth they
Yeah,
do that because I can't, you and I we just give it all
I
out.
know. I know. We really probably should pull back. So if you've been listening, maybe moving forward, we won't be giving everything, but today you got it all. So
Yeah. Well, and
go
also
learn
if
about
you
your cycle.
appreciate us, please write a review and give us a 5-star review or sorry, a 5-star think rating and, you know, share it with other people because we do really love it, but it is a lot of
Hmm.
work.
Hmm.
So
Yes, it is.
help keep us afloat. Okay. Anyways, we'll talk next week. Thank you, Dr. Leah. This was really, really helpful for anybody who is, you know, wondering if their cycle is normal, or maybe you weren't even wondering and now you're going, oh,
Yeah,
news to
yeah,
me. Like the man who
exactly.
puked every morning and didn't know that that wasn't normal. So, okay, talk to you guys
All right.
later.
Bye.
Bye.
If your heart aches for a baby, whether you're dreaming of motherhood someday or you're already on the path and it hasn't been going as you imagined, I want you to know that you do not have to do this alone. Consider joining me inside of my Womanhood Wellness membership. You get a custom blueprint unique to your woman essence type, which is where you are right now on the journey. You have access to all of my courses and content, which includes how to boost egg and sperm quality, the energetics of fertility, investigating fertility, optimizing IVF if that's a path you have to go down, navigating pregnancy loss. I have my Essential Foundations course where you learn all the things that you really need to know to have a thriving hormonal and fertility system. You learn the Hormone Handbook where I dive deep into all the different hormonal imbalances and what you can do naturally to rebalance them. I have deep dive courses on vaginal microbiome, in detoxing, on mindset. I give you my natural medicine protocols. You have the ability to order labs on your own. You get discounts on supplements and other products. I have organized the community by your season. So if you are breaking up with birth control, you can jump in a chat with women in that exact same season. If you are trying to conceive, or if you are going through pregnancy loss, or infertility, or IVF, or low libido, there is a group of women who are going through the same thing. We also have full community areas like our breakfast club, where every Monday we share what we're having for breakfast to inspire each other, and our daily flow, where we connect as a collective community and do challenges and learn from each other in that way. On top of all of that, I do a monthly live Q&A where you can bring your questions, and they're always recorded so you can listen if you can't make them live. And then I have various calls with other practitioners like Sadie, our amazing personal development coach, and so many others where you will be able to receive healing and learn other perspectives. Being a member inside Womanhood Wellness also gives you discounts to join my upcoming immersions. Take around 22 women for a month to dive deep into a specific topic like decoding desire, or building your dream life, or navigating painful periods, or navigating unexplained infertility. This is the place that you want to be if you want to know all of the natural root cause and supportive measures that you can take to optimize your womanhood journey and your path to and through motherhood. Head to womanhoodwellness.com and use code podcast to save 20% off your first month. I can't wait to see you inside. In order for others to hear this information, please leave a review with Apple Podcasts, subscribe, and share with a friend who would benefit from this content. Please remember that the views and ideas from this podcast are for informational purposes only and are not intended to be a substitute for medical care of any kind, including the diagnosis and treatment of any disease. Consult with your provider before integrating any of this information into your own healthcare plan. A healthier future starts now, and it starts with you.